Welcome back to the Sports News. Here we're going to be interviewing Patel and Lou Holtz. So first of all, it's the second leading cause of cancer death, trailing only lung cancer in American men. However, early detection of prostate cancer can lead to successful treatment and a much better prognosis for the future of the patient. So why don't more men get screened? And what should they do if they have prostate problem? Joining us this morning is Dr. Vip Patel and Medical Director of Florida Hospital Global Robotics Institute, and Lou Holtz, legendary football coach, sports analyst, and college football Hall of Famer and prostate cancer survivor. Good morning, gentlemen.
Good morning.
Good morning.
Dr. Patel, why is early screening so important and why aren't more men having it done?
Well, as you said, prostate cancer is the second leading cause of cancer death in men, so obviously it's important. And as with all cancers, finding it early before it's spread and can cause mortality is the key. With prostate cancer, I think the key is, talking about it, having some awareness as you approach age 50. Start talking to your doctor about the implications of screening and how important it is. If you find it early, you have so many more options.
All right, that sounds good. And Coach Holtz, could you please tell us about your experience?
Well, I didn't ever get a PSA test because there's no way I'm going to get prostate cancer. That happens to other people, maybe not me. I'm 76 years of age. I have a bad back. I go to the Mayo Clinic. They run tests. They come back and say you have prostate cancer. I didn't go there for it. Never thought I had any symptoms. All of a sudden, what am I going to do? There's approximately 422,000 words in the English vocabulary. But the most important word is choice. What choice am I going to make now? Am I going to get invasive surgery, chemotherapy, radiation, etc.? I had a doctor friend and she strongly recommended I go look at Dr. Patel. After studying him and the robotic thing, I thought that's the thing I need to do. I told him I'd like to do it and he said, I was in Southern Cal 4 years. When you're coaching at Notre Dame, we lost all 4 years. I'm not sure you would want me to do this surgery on you. I said, I trust you. Is the best choice I made.
All right, well, that's good to hear. So Dr. Patel, you're coming up on a pretty significant landmark for a surgeon. Can you tell us about that, please?
Yes, thank you. Tomorrow's the big day. We perform our 10,000th robotic prostatectomy and really want to thank all those men and their families out there for all the trust they placed in us and to congratulate them really for the courage, for the fight against prostate cancer and to really keep them engaged in awareness and talking about it to their friends.
Sounds good. So you would say, being proactive is probably the biggest thing that, men can do once they kind of get to that age where they could be potential for getting cancer, correct?
Well, I think the key is having the right to know. If you have something that's wrong with you, I think you want to know you have it, and then at least you can make your own decisions. What you don't want happening is that, these cancers are end stage and you don't have any choices. So screening is important to find it early, and then you have so many options.
Sounds good. Well, thank you very much. And Coach, what would you tell other men who are worried about getting screened for prostate cancer?
The reason I'm here is just to let people know your life does not end because you have prostate cancer. But you owe it to yourself, you owe it to your family, you owe it to your friends to get checked. Go get checked. Don't run the risk of it. And once again, don't be afraid if you have it. It can be handled. You can live a happy and productive life. And that's the reason I'm here. Please get your PSA checked.
I think you have a really good point, just bringing up that you never thought it would happen to you. I think that's how a lot of people feel about a lot of different ailments and kind of giving that perspective that it really can happen to anyone and it's as simple as getting checked is very, very good for our viewers to know. So moving on, Dr. Patel, what should a patient look for in a surgeon if they do require surgery?
Well, I think first is once you find it, explore all the options. Talk to your primary care, talk to your urologist. They're going to be your trusted source. If you decide to have surgery, as with anything, the experience does make a difference, and then you start to search and look for somebody who's done a lot of these and has had good outcomes.
All right, that sounds good. And where can we go for more information regarding this?
Well, I think there's a plethora of websites out there and books. The American Cancer Society has fantastic information, the American Urologic Association, and our own website, globalroboticsinstitute.com. here in Florida. There's a lot of good information out there as well.
All right, well, sounds good. Well, thank you very much. It's been a pleasure talking with you. I hope you have a great rest of the day, and we appreciate all the information.
Thank you, Chase, and be sure and tell Barry Alvarez Lou Holtz said get checked.
All right, sounds good. Yeah, I'll give Barry a lot of tips when it comes to coaching, so I'll make sure I run that by him too.
Yeah.
Thank you, Chase. Thank you, Madison.
All right, take care, gentlemen.